Secretary of IIT Kharagpur, Chennai chapter, to present the memento to Mr. Professor Arun. Next, we have Debate Square with Dr. Balaji Sampath, founder Aha Guru, Mr. Shivakumar Perumal, Assistant VP, Healthcare Provider Practices Head at Cognition, Professor V.R. Muralidharan, Faculty at IIT Madras, and Mr. J. Krishnan, MD and CEO, Unimity Solution. Mr. J. Krishnan will be moderating this debate. One more chair.
We are coming into our session at a time when we should have probably be finishing our session. So I've requested our panelists to get ready to play in the T20 style. And they have most willingly obliged. We have a very interesting, powerful group of panelists. And I want to quickly get to first saying that though this concept was called Debate Square, we debated amongst ourselves and we decided that it's really not a debate. That the importance of digital empowerment is beyond debate. So it's more presentation of views which are going to come from all these people who have been having hands-on experience in each of these areas, and their observations and their recommendations are probably beyond debate, but to be taken forward subsequently for further discussions. So, Professor Muralidharan, I'm going to ask you to open the batting. You've been having a unique combination, both exposure to policy as well as technology initiatives in healthcare. What do you think are the three most important areas where technology or digitization would have maximum impact on healthcare?
Good morning. Thank the organizer for inviting to be part of this event. Let me begin by saying that many speakers have already more explicitly have stated, which is the overarching objective of any healthcare system should be that it should be designed, I underline the word, should be designed consciously in a way that is effective, efficient, affordable, accessible, of a certain quality, and responsive to the needs of the people, responsive to the needs and expectations of the patients themselves. Many have alluded, directly or otherwise, to the notion or the challenge of empowering patients in particular. So what does that mean? And I would like to just, context of huge opportunities made by the new technologies. Is it okay? So I said it should be designed. So who is to design? We all expect naturally that should be the role of the government. But we know that the healthcare system consists of both private and public. Just to give you an idea of the presence of private sector and public sector, very broadly speaking, about 70%, in some states it's even 80 plus, of total outpatient care delivered is made from private sector. I mean the OPDs of different kinds. Roughly about 60%, could vary from 50 to 60% of all inpatients are met by private sector again. Okay, now why has private sector grown to that large extent? Actually, it has grown passively, not by any conscious design. Of course, government will say that we are, as far as government system is concerned, there is some planning and one can justify to some extent, but actually, the role of governance, that is the state, is to look at both the design and functioning and growth of private and public sector. The Minister for Health, just as the Minister for Aviation, ought to be, and he is concerned about private and public airlines, he has to work towards designing. And there are many pillars of healthcare system, as we say. Very broadly, there are 6 pillars, and you can add a 7th one as the community. You have the issues relating to financing, who is paying for your care and how much, and who is providing the care, where can you go and access care, private or public. Who is providing also has the question of whether you get the care from a physician or nurses, the HR issues. You have this role of the issue of technology in the form of medicine and other devices. And as we'll conclude soon on this issue, that this is one sector which is least regulated. And in that context, we are going to talk about digital technology. I may just add now that a month ago, the Department of Health Research has formed a Medical Technology Assessment Board, of which I happen to be a part, and we are trying to figure out what it should be doing in the Indian context. Then you have the 5th pillar, what we call as the information system, that is required as part of the design and functioning of the system. And then lastly, the issue of governance. Governance is there in all other 5 pillars as well, and it's also by itself a standalone issue. And then how do we engage? The whole system is designed in such a way it is engaged, it is effectively engaging with the people, the citizen, and the patient. So as I mentioned, that therefore this 70% of this outpatient care, 60% of the inpatient care from private sector is one of the least regulated. When I say least regulated, in what sense? In many ways, in terms of how we can go and establish a hospital. Till today, there are hardly any state in India where you don't necessarily have to register your polyclinic as a polyclinic. Of course, the person who is delivering care from that polyclinic is licensed, but the unit from which he is delivering that as a hospital. Well, many hospitals do have registered, but then it's not mandatory. Imagine situation, that's where we are. So in that kind of very weak regulatory setup, particularly in regulating medical devices, we are talking about introduction of new technologies in the form of digital technologies. What I would like to raise here is that all these new devices in the form of apps and others, who is evaluating them? Should they be evaluated in the same way as a drug is being evaluated? Because you're talking about patient care. A new patch is coming to monitor live certain things. And he mentioned about standards. What's the role of standards here? It's going to be, and at the same time we are worried about regulation as well. Should it be evaluated in the same way as a drug is evaluated? This is the question. I think I will, for the first round, stop here, and then if time permits, but that's one of the key questions I want to pose in the light of this emerging opportunities, offered by digital technology. Because we are talking about the eventually reducing the impoverishing effects of healthcare on people. And technology and drugs is one major issue. What is the evidence of the past of all new devices being introduced on the cost of care? Now that's very important. And in the context of India where payment is made out of pocket, financing is entirely out of pocket, fee for service, Can we think of really, can we think of a day when such technologies eventually will reduce impoverishing effects of healthcare? Thank you.
Thank you, Professor, for those opening remarks of yours. Shivakumar, now coming to you. You've had global experience in making healthcare solutions available in the US, Europe, other countries. What do you think, a couple of initiatives which have worked well in the West, how could they be brought to India and would they have maximum impact if you could identify any of those which you would like to share?
Good afternoon, everyone. Okay, I can talk about a couple of areas, 2 or 3 areas where we have seen success, good adoption, which can be brought to countries like India and make it successful. The first one I have in mind is chronic care management. What I mean by that is there's a lot of big population suffering from chronic care, such as diabetes, COPD, and so on and so forth. We do have several solutions that are developed. Some of them are actually adapted, some of them are not. But we do see that there is a good success in adapting in the Western world. That I can touch upon some of those details on how that can work here. The second one I would like to bring is the remote health or the remote patient monitoring or telehealth. I mean, there are several names to it. It's a combination of solutions technologies, which is instead of saying it can be adapted, I think it's a need of the hour. I think that's how I put it. It's a necessity moving forward for various reasons. I think Dr. Ganapathy has already gone deep into what are those technologies, how it can help, and why it's needed. I'll cover that as well. The third is the emergency medicine. Access to emergency medicine and timely care, saving lives, including the ambulance management, etc., etc. I think Mr. Umashankar covered that. That is the third point, which is working very well in the West. And we are seeing success in our country as well, and how it can be made prevalent and pervasive is the third point that I wanted to make. To cover all of these, the 3 points, another initiative that is very important, which had been going on in the Western world for a very long time, and that's bearing fruits, is the having a connected patient data. It's like we call it as HIE, Health Information Exchange. Several countries are taking initiatives to do that in a national level. That is actually a huge undertaking. But even if it's not done at national level, even before that, doing that at a regional level, connecting all the patient data, so that wherever the patient goes, it's a single patient information. The doctors and caregivers have the information about the patient, the background history, all in the fingertips, and they can both provide effective care and timely care to save lives. Right. So that actually cuts across all the three areas that I talked about. Now, before I go slight detail into these 3 areas, one point I want to cover is there's always a question, will this be successful? Will we be able to adapt? I think Dr. Ganapathy mentioned that there are a lot of POCs, there are a lot of pilots, but nothing is becoming mainstream, nothing getting commercialized. If there is a technology or medical device, that gets commercialized and that gets used. But then when it comes to social, technologies to empower social people related, right? That doesn't get commercialized, right? It takes a backseat. But then I think the good news is that it's going to be adapted now because of the technology improvements, the infrastructure. The infrastructure is key. The broadband, internet infrastructure, that is key. The government is actually recognizing the importance of doing that. Third point, the important point that I want to bring is the millennials, What I mean by millennials is the new generation of children or people who are digital native. So they are very well versed in using mobiles and technologies and so on and so forth. That is going to help in both patients and providers, caregivers who are actually coming out of college.